This is Laurens Holve, and I'm just giving a short talk on what are called cervicogenic headaches. So firstly, what are cervicogenic headaches? Well, these are headaches that emanate from the back of the head, going over the head towards the eyes, and clearly they cause discomfort, headaches. They're relatively uncommon, up to about 4% of the population, and it can affect anyone from about 30 to about 60. That's not to say people over 60 don't suffer them, but that's the main group that I tend to see. They are really mediated from what are called the spinal nerves that emanate from the top three vertebrae, C1 to C3. So that's from there to where you probably can't see. It's right from the base of the skull, a bit lower down, and those spinal nerves get irritated, and by sort of neurological pathways they start being irritated and cause referred pain going over the head and in the eye. Some people complain of eye pain, and that can actually be referred pain from the back of the head. Anyone with headaches, there are things to look out for. For example, if you've got any rash or anything like that, obviously things like meningitis can mimic it. So any headache should be looked at seriously, but luckily most we get are just purely neck mediated. So the main cause are any spinal problems. When I say spinal, usually functional problems and movement of the neck. It's usually accompanied by stiffness. A person can't or has very much restriction in their neck, perhaps one side more than others, and they complain of pain, mainly coming from that restricted side going over to the head. What happens is that you get a lot of muscle contraction, and the cause are either restrictions on what are called the facet joints. These are the small joints on the side of the neck which mediate movement, which become inflamed, irritated. You get the muscle spasm and the irritation of these spinal nerves, and then you feel that referred pain going over your head or to your eyes. Over-the-counter treatments can be helpful. You're looking at things like naproxen, ibuprofen, cocodamol, these sort of things. But the main problem with those is that they don't last. So you take them and then the headache comes back. You take them, the headache comes back. So it's not really that satisfactory apart from in an emergency. The mainstay of treatment is both physical treatment or indeed acupuncture. These can be used very successfully in treating cervicogenic headaches, because what you're doing is loosening up the musculature and the actual joints in the neck. So those structures are released, the muscle spasm tends to reduce, and the pain goes. And this is much more on a long-term basis, so a few sessions can actually get rid of it. Similar acupuncture, by putting needles into these muscular structures and around these joints, help reduce the pain, increase blood flow around that area, and again help reduce pain, not just in the short term but long term. And both treatments actually work very well together in reducing pain. I see a lot of patients with that, and I very often use a combination of treatments successfully to help a person alleviate their headaches. If conservative treatment like osteopathy or acupuncture doesn't help enough, and really after a few sessions, then it's more invasive treatment. You can some people look at spinal injections. That's bits of steroid, lots of steroid put on the facet joints to reduce irritation, or indeed nerve blocks. But the same problem arises. It may just be temporary relief. So obviously osteopathy and acupuncture, in my opinion, are probably the most efficient ways to get rid of it in the long term. It's non-invasive, usually successful quite quickly, and obviously you don't have to go for the more invasive treatments. Any questions, by all means email me. Otherwise, look on my website. I've got quite a bit written on there on these sort of headaches.